Hello and welcome to News 360. We are live from the News Hub here at Adesanwe in Accra. I'm Mr. Morning.
And I am Portia Gabo. Coming up, the headlines.
News 360 Headlines is brought to you by
Heaven Insecticide Spray and Coil, Deluxy Acrylic Paint,
My Life Insurance.
And tonight, barely 24 hours into lockdown of some cities, residents engage in panic buying as Interior Minister expressed a shock at the action.
Meanwhile, as some cities go under a lockdown, Bank of Ghana asks financial institutions to continue to serve the public with minimum staff numbers.
Majority members of parliament vent anger at the minority for boycotting today's proceedings.
And also coming up, Ghana's upcoming data on coronavirus suggests the country is likely to record high numbers of the disease in the next few weeks.
And on the international front, Italy appears to have the highest death rate on the planet as the coronavirus pandemic bites hard at the country. Right, we are live on News 360 right here from Adesanwe in Accra. Right, so our correspondent Joseph Armstrong has been in town today, and we'll be speaking to him right now to find out what he has gathered so far about transport and markets and the panic buying that has taken place today. Hello, Joseph. Good evening, and thank you for joining us. Joseph is still in town. He's still somewhere. We're trying to establish contact with him to speak to him about today's activities in town and what he has gathered so far. Hello, Joseph.
Yeah, good evening.
Good evening, Joe. We understand there has been a lot of activity in town today. What exactly can you tell us at the time of the day?
Exactly. So as I speak to you now, I'm not far from the Dansuman Well filling station, and also where the gas filling station is located. As I speak to you now, there's still a huge crowd here. Well, the filling station is closed, but then we still have more people waiting outside. Some have still queued, waiting that tomorrow morning, if they open the place, they'll be able to get some gas home. And the crowd, I must say, that is so huge and it's so terrible. So that in the afternoon, they have to close the entrance because of the way people were rushing in there. And right from there, I moved to the Dansuman market, which happens to be a market that has been described for market that only the rich goes there. Dansuman market, if you know, is a very nice market, of course. But today, this afternoon, the whole place was choked with human beings, and people were busy shopping. And some of the few things they were busy buying, it was gari and beans. That is one thing I took particular notice of. And from there, I moved to the Tuesday market. And one interesting thing about the Tuesday market is that Tuesday market only gets busy on Tuesdays. But today, Saturday, the place, as usual, you may think is a Tuesday market. As you may think is on Tuesday. The whole place was as busy as Agushi market. That is when I got to Agushi market. The difference between Agushi market today and Tuesday market was no different. And also at the bank, it was also terrible. There was also queue at the various banks I visited. So these are some of the things happening in town today. And also, I must say that when I go to the VIP station that is around Circle, thereabout, also there are a lot of people that were ready to travel outside Accra. So these are some of the few things I observed today in town.
Right. Thank you, Joseph Armstrong. I mean, Joe has been out and about in town, trying to find out what is happening in the markets and also in the banks. And
there's a lot of panic buying in town today. Have you done your last minute shopping yet?
I've got a few things that I will buy. I should be asking rather because you are the lady. You are the woman who will do the
Well,
shopping
still on
for the
this,
home.
there's been a reaction from the Minister of Interior, and he has expressed disquiet at the panic buying by most Ghanaians ahead of the lockdown on Monday. Ambrose Derry, who toured some market centers in Accra, says the restrictions are being misunderstood.
The president was clear in his directives, and on Saturday, the markets were flooded with shoppers all ahead of a Monday lockdown.
I've just gone around a few places today, and there appears to be some misunderstanding about some of the things. The rush to buy things, the rush to buy food is totally unnecessary because the measures have made it possible that you can go to the markets and buy food, and that wherever food is sold would be open. So the rush before the deadline is totally unnecessary and a misunderstanding.
The Interior Minister Ambrose Derry says the action taken by citizens is a dangerous one.
Filling stations, gas stations are unnecessarily crowded. First of all, they will remain open. And secondly, it's a dangerous thing to go with that crowd because it could cause fires. But all I can tell you is that these measures have been well thought out by His Excellency the President. The security will do its work. The open air markets, we are allowing only food stuff to be sold. And therefore, non-food stuff will not be sold, creating more space, and therefore the social distancing is going to be possible, and hygiene will always be observed.
Former Deputy Attorney General Dr. Dominic Ayine, who is against the law that gives the president backing to impose the lockdown, says the consequences for persons who may flout the orders could be dire.
In terms of the regime, the person is, subject on summary conviction, to I think 5,000, a fine of 5,000 penalty units, or a term of imprisonment that is equivalent to the 5,000 penalty units. That is the regime now. My advice to people to obey is based upon common sense, because we are in a public health crisis. It is an emergency, and Ghanaians owe themselves a duty, as well as their neighbors a duty, to keep, to themselves, to lock down, and then ensure that we don't spread the virus.
Now, President Akufo-Addo says the 2-week quarantine is subject to review is the best way to deal with the coronavirus. The president insists there's the one-size shoe doesn't fit all at this time, and approach globally and keeping the people at home 2 weeks and checking them for the virus will aid Ghana fight the pandemic. Let's have a listen at the president.
We cannot afford to copy blindly and do all the things some other well-developed countries are doing. There is no one-size-fits-all approach to this pandemic. We have a unique situation in our country, and we must take it into account in dealing with the disease, whilst meeting all the 6 key WHO guidelines on the most effective ways of combating the pandemic. It'll give us the opportunity to try to halt the spread of the virus and scale up effectively contact tracing of persons who have come into contact with infected persons, test them for the virus, and if necessary, quarantine and isolate them for treatment should they prove to have the virus.
All right, so the president is firm in his mind. He has made his opinion known on how he wants to fight the corona pandemic. So we are joined by Dr. Augustina Silvercan, and she's a research scientist. Well, yeah, she's with the Kumasi Center for Collaborative Research. Doc, good evening, and thank you for your time on News 360.
Good evening, and good evening to all your cherished listeners and viewers.
Absolutely. Doc, we are kind of experiencing some partial lockdown at the moment. I mean, from the president's statement last night, we can deduce that. But do you think this partial lockdown can help Ghana deal with the virus?
Indeed, I support the measures taken by the president. I'm positive that if we adhere to all the measures, we should be able to limit some way, somehow, the transmission of the virus. Importantly, within this two-week lockdown, partial lockdown period, I'm sure we'll be able to identify more positive cases. We'll be able to pull them out of the entire community or some communities. We'll be able to isolate them. We'll be able to manage them. And importantly, we'll be able to aggressively trace their first contact, their second contact. And then also importantly, I expect that whilst adhering to these measures, we will also enhance our testing. Because if we don't test, but we sit down and just go through this partial lockdown period, then at the end of the day, we will not really be able to identify any of the cases. So it is a laudable idea, and I'm all for it.
All right. So we also understand that certain areas are exempted from this partial lockdown, like the markets, the pharmacies, and the financial services. But still, people are rushing to those places to make last-minute purchases, to cash some amount from the bank to home, and so on. Do you think they need further information in that area?
Yes, I mean, driving through town today, I was amazed, and I became worried, because if we want to go through social or physical distancing, but the numbers around are huge, people are moving, we see a lot of crowds, then if we don't take care, the purpose for the measures the president expressed yesterday night may really not even work out. And I'm happy the Interior Minister has come out to say that it is not really very useful for people to be doing something known as panic buying or last-minute buying. So I think people should relax. Thankfully, there will be some leeway for people to go out and buy whatever they need. But for me, I keep on saying that, look, if you don't really have anything to do in town, the expectation is that you stay at home, you adhere to the usual hand washing, use of sanitizers bits, so that at least you will not be able to carry the virus.
Right. Certain hot spots have been identified. For instance, in the Greater Accra region, Ashanti, and the others. Do you think they are enough to kickstart the fight against spreading the virus?
So I was excited when the president used the word hotspots, because I have been yearning to hear the word hotspots, and I'm happy that the Public Health Division has been able to identify some hotspots. But indeed, the numbers churned out are a bit low in terms of the hotspots. Of course, we don't want to see an escalation of these numbers. And I guess that apart from the identification of these hotspots, one way we can also use to identify some more potential hotspots may be to rely on the hotlines given out. I mean, we can go into the data, so we can look at the calls received. I'm sure the calls are hosted somewhere. So we can look into the calls. And for example, we may at the end of the day realize that, look, there are a lot of calls coming from, I don't know, Kasua or Ewutu Senya, and we may have already identified a positive case around Ewutu Senya, so that by so doing, we will also be able to identify more hotspots. I think we need a lot of technology-related things to enable us identify some of these hotspots. But I guess it is not just about identification of these hotspots, but then it is also about moving into these hotspots and then ensuring that people are tested and people are traced and the positive ones are isolated and managed.
Right. That was Dr. Augustina Silvercan, and she works with the Kumasi Center for Collaborative research as a research scientist. Thank you for your insight.
Thank you.
Let's now focus on the frontline staff and some 10,000 health personnel and allied professionals attending to COVID-19 pandemic patients have been secured in a special life insurance cover. The Minister of Health, who signed the notice to all heads of the health agencies, has asked that the appropriate documentation be done to facilitate the next step. All frontline staff involved in the response have been insured under the following insurance cover: Group Life, 350,000 cedis per life; critical illness, 25,000 cedis per life; and total temporary disability, all causes that a 10,000 cedi per life, and the total premium is estimated at over 10 million cedis. Let's now speak to a health worker who wants to remain anonymous. Thank you so much for your time. Now, let's focus on the protective personal equipment. Do you have it at your facility?
No, we don't have anything like that.
So how are you coping?
We are managing, just that we are praying.
So, for example, if there's a suspected patient, what would you do?
Honestly, we don't know what to do. We've not been trained. We don't know anything what we are just reading it from the net. So we don't know what to say and what to do. Honestly, when somebody comes with that condition, we don't even know what to do. We just refer the person. We don't even go to the person. We just refer the person to go to the highest point.
So with this currently ongoing, are healthcare personnel afraid at the workplace?
Pardon me, I'm not getting you because of the network.
What currently is the mood among healthcare personnel at where you work?
To be honest, we are all afraid. Honestly speaking, we are all afraid. Even when there is a patient, we don't even want to go to. We don't want to attend to the patients because we are afraid. We don't have any PPE. We don't have anything. We are having just a normal thermometer, which you can imagine. So we are facing difficulties. Honestly speaking, we are facing difficulties.
Have you made these concerns known to your regional health director?
We have told them. They know everything. We have told them. They know everything, what is going on at the smaller facilities. But for us, they don't respect us, so we are also looking at them.
And what has been their response? What have they been telling you?
Yeah, with the lines they are thinking about, they will bring us PPE, but we are waiting. So we don't know the time they will bring it, but just that we are waiting.
Well, in the meantime, do take good care of yourself as we await the PPEs to your facility.
Yes, for now, we are coping. Just that we are not attending the clients. When we see the person is seriously sick, we don't even attend to the person. We just refer the person to go to the highest point. So we don't attend to the patients. Oh. We are only trying to take care of the pregnant women.
All right. Thank you very much for your time. And we've been speaking to a health worker and who says they do not have the appropriate PPEs to attend to suspected COVID-19 patients. You're still watching News 360 from the News Hub. And as the COVID-19 pandemic unfolds, journalists on the beat can't switch off and the work would be overwhelming. Despite the global stress, Wendy Lyer reports the work must go on.
This is Media General's newsroom, a lean staff on duty. This is not the number on a normal day, but we definitely are not in normal times. We all need to stay safe by practicing social distancing. But the work must go on. Prior to Ghana recording cases, our reporters spread across the country developed stories related to coronavirus. Technology is being utilized. News anchors on different platforms and other essential departments work hard to bring the public up-to-date news. How has journalism been impacted by the pandemic? Two journalists, a Rwandan and Palestinian, share their experiences. Both countries are under lockdown.
Only essential service providers are allowed to get out of their homes. So these people who are allowed to get out of their houses and drive around have stickers issued by the police.
Working hours, it's based on shifts, dividing throughout the 14 days between the employee. Some employees will work 14 days, and while others are right now in quarantine, then everyone will swap shifts.
What about safety measures?
The Palestine TV has distributed special uniforms that protect the journalists and cameramen who are working in the streets, and I feel safe.
I feel safer when I'm working from home, and I feel not safe enough when I'm on field because I tend to touch many objects. I tend to share a microphone with people.
According to the Global Investigative Network, topics that have been heavily covered include government's preparedness, hospital readiness, the supply of equipment, officials telling the truth, and commercial exploitation. On March 23, Reuters.com reported of a White House reporter suspected of having contracted the coronavirus. The White House Correspondents Association raised questions about the viability of press briefings that gather dozens of journalists and the Trump administration officials in a single room each day. CNN on March 24 reported on a prominent 30-year-old television journalist who died in Zimbabwe after contracting COVID-19, the first person to die in the country from the virus. Zororo Makamba was one of the two people who tested positive for the coronavirus. NBC News on March 20 reported the death of its longtime employee, Larry Edgeworth, 61, an audio technician, but also suffered from other health issues according to his wife. For instance, journalists who are assigned to Ghana's Parliament House are still reporting from there as the House is still in session, although some parliamentarians have been asked to self-isolate.
We are not too sure who we have come into contact with. The reports are quite numerous, flying in here and there. Looking at the nature of our work as journalists, we need to get the job done.
The Speaker, Professor Aaron Michael Quay, asked all staff except those identified as providing essential services critical to the legislative business currently taking place in the House, or a matter referred by the House for an urgent consideration, to proceed on their annual leave with immediate effect. All officers on contract or temporary appointment, MP research assistants, and other ancillary service providers working in the premises are also required to take their leave or keep away in a bid to decongest Parliament for a safe conduct of essential business. Despite the adrenaline to get the work done, fatigue sets in. The Ghana Journalists Association is advising journalists to adhere to health and safety protocols. But for the journalists reporting on the outbreak, it is indeed overwhelming. When you say a prayer, remember to say one for journalists as well. Wendy Lai, TV3 News.
Now, the Kolebu Teaching Hospital and the 37 Military Hospital continue to receive donations in efforts at combating COVID-19. This is also to help ease the burden on government and to provide maximum protection for the health workers.
The outbreak of the coronavirus pandemic has resulted in huge efforts in combating. Some 3 cities will undergo a lockdown to stop the spread of the virus. Several health facilities are reeling under inadequate logistics. Public-spirited persons and organizations have stepped in to help. Both the Kolebu Teaching Hospital and the 37 Military Hospital received items expected to help fight the pandemic.
We appreciate the role we are playing at the war front, so this is going to motivate a lot more of the staff to volunteer and to be able to commit themselves to the fight.
The health workers at both hospitals promised to put the items to good use.
You're watching News 360 from the News Hub. We have more news coming up shortly. Do stay with us.
I'm a proud old student of Agri Memorial Senior High School. My school needed a facelift and Deluxe acrylic paints came in
and did their magic, and wow, the school looks
the touch is simply classic.
The school environment is now conducive for us all to teach and learn.
After the painting, our colors are just phenomenal.
Exquisite, a conducive place to study now.
Proud to be an amazing.
The luxury acrylic paints you can't contest.
My way insurance.
Ese adwuma ntimi mami eni nkonkonsa kakra. Ono kwano no, da bia de ade foforo ba. Na die ni. My way insurance, you know.